Welcome back to Stock Painting Snippets. So there's a term that often we hear applied to people who have a whole range of conditions called disordered breathing or irregular breathing. And this we often see in POPs, but obviously it can be in a whole range of diseases like asthma or chronic bronchitis, or even people who are stressed. What is disordered breathing, Boone?
Yeah, so I'd add into that phrase dysfunctional breathing pattern, because it's a label that's used interchangeably. And I think it's essentially any breath pattern that is not considered physiologically normal. And really there's a huge range of breath patterns that are not considered normal. So it's a very nebulous question with a very vague, almost wishy-washy answer, Mel. But the way I look at it, and this is my interpretation, I'm not a breathing specialist or I'm not a respiratory specialist, but I like to practice breath work, and this is kind of self-experimenting, is that anything that deviates from the ideal breath, in my view, which could be quite strict, is dysfunctional breathing.
And remind us on your view of the ideal breath. I know we've talked about it in your demo.
No, sure. So the ideal breath is one that is rhythmic, regular, same flow rate throughout the entirety of the breath cycle. So it's a nice, steady flow throughout, rather than and it doesn't have to be deep, although deep can be quite good, but it's diaphragmatic, which means that you're breathing through your diaphragm and therefore your belly. And the way I might just demonstrate this is, if your diaphragm are like a pair of bellows and you want to expand your lungs to bring air in, when you breathe in, your diaphragm should come down, and so you're expanding your lungs without moving any of your chest muscles. And as your diaphragm moves in, your tummy is being pushed out. And so this is the normal breath pattern, where the chest stays relatively still, diaphragm comes down on the breath in, the belly comes out. And the opposite is true when you breathe out, because the bellows are pushing out. I'm going to try and demonstrate that. So when the bellows push out, the tummy sucks in, the belly button touches the spine. And again, all the action in expanding and contracting that lung volume happens at the level of the diaphragm. And now, of course, if you take a super deep breath, you can get the kind of mixed pattern, which is breathing in. And towards the end of the breath, when you've fully expanded your diaphragm, and your belly is pushed out, your lungs expanded, to gain that extra volume, you use your muscles of respiration, which are not your diaphragm, but your chest muscles, so your ribs and your shoulder muscles, and you pull the rib cage up to physically expand the rest of your lungs. Okay. But this is highly inefficient now, because we're not designed to breathe through our chest muscles, or we're not designed to breathe like this.
Can I say something? I remember being as a student nurse, and when I was a student nurse, I think we did a respiratory course, and I think what's quite interesting to learn when we know how we breathe is that we have this idea that we're somehow sucking air in, and all the work is here, and we're trying to get the air into our lungs this way, and then realizing it's actually your diaphragm that sort of forces air in. It's a difference. I think common sense people think to get more air in, it's something they have to use these upper muscles, because they're somehow trying to draw it in, and it's a different way of thinking.
So I quite like that analogy. You're creating a vacuum actually by moving something down below. So you breathe through your belly, and some yoga instructors would say use your belly breath technique. And so when you create this vacuum, air will automatically come in. You don't need any suction power in your throat, your nose, or your chest. And when I just did that, see what happens? My chest starts to move. It's a very unnatural breath pattern. And so if you think about the reasons why dysfunctional breathing might occur, i.e. from my definition, anything that deviates from the normal ideal breath, it's when you are having to do this kind of actions. And that's when generally you have a heightened amount of adrenaline or stress, whether it's orthostatic stress, physical stress, emotional stress, traumatic stress, infection stress. These are all factors that can drive your breathing pattern to come away from the normal pattern. And the shame is, chronically, with stress seeping in daily, we get used to this abnormal breathing pattern as normal.
So a lot of us are actually breathing dysfunctionally and probably not even being aware of it because we've adapted to it for the stresses of
I
modern
can tell
life.
you, Mel, you were just dysfunctionally breathing there, and so was I as I was speaking.
Yeah.
Because as I'm speaking to you now, we're stressed, as in I have to formulate a thought on camera and spit it out. And so you can already see I'm not breathing properly. But as I relax into it again and become conscious, then I start to breathe. And oftentimes, Mel, I have to catch myself 10, 20, 30, 50 times a day to say, hang on a minute, what are you doing? Let's breathe.
Interesting. So the first thing is actually the awareness.
Yes.
And that's why meditation is quite good, isn't it? Because
Absolutely.
that's when you actually become, and sometimes when people meditate, they might just pay attention to your breath and see that you're breathing 40 times a minute because you're stressed or so the awareness is good, and to say, am I breathing healthily and normally, or is this disordered? And then once you identify, then you carry on with the breathing that you've described.
Correct. So you can self-correct immediately. The moment you become aware, you don't let your breathing become subconscious anymore. And remember, we talked about the breath control being one of those systems under dual control. Conscious, which is what we're doing now. Subconscious is when I'm talking to you. And the breath is just coming in as and when it needs to come. So one top tip, that I've just thought about is whenever you need to drink some water. So if you have vasovagal syncopated POTS, we're going to recommend lots of water. Before you put the cup on your mouth, think about what your breath is doing. And that forces an immediate check on breath. So cup to mouth, breath check. And then drink. And the more you become conscious of your breath checks day to day, the better it is. At the end of your Zoom consult, breath check. And I don't do it often enough, Mel. What my breath checking time frame is between consults in clinic. I often do a breath check, especially when I've had to explain a very difficult concept or have a kind of robust dialogue with a patient. I come away and I really see that I'm dysfunctionally breathing, but more than that, I feel stressed. Exactly. So this adrenergic drive from just running a bit late in clinic and having a robust conversation, and then translates into physiology, even in somebody who I consider, I myself, a very focused breathing kind of guy.
So if that accumulates over days, weeks, months, years,
without awareness,
then
you're stuffed in a dysfunctional breathwork pattern. But here's the thing: let's make yourself unstuck by being aware.
Yeah.
If you are aware, you can come into the breath, and as you say, watch our videos on how to breathe.
And based on the benefits that we were talking about in our previous video on breathing, we can see why it's so important to recognize it and then to adjust it to get yourself into the proper physiological breathing.
Exactly. So for me, it's been a personal game changer, because when you track into a parasympathetic state or a more balanced state in your autonomic nervous system, not only does your physiology change, the physiology promotes the ultimate expression of a healthy biology, which may include healthy cognition, healthy thoughts, healthy creativity. And some of the most impressive creative moments I've had is during moments of deep breathing exercises. And it's a real strange thing to say, but to become your very best, and this is going beyond improving health and treating illness, it's actually becoming the best version of yourself. Breath work is a very important component, because when you shift your autonomic nervous system state from a very reactive sympathetic state into this very, very creative parasympathetic feminine state, you open yourselves up, you open your brain up to a whole different way of working with sharper focus, more attention span. And actually the day-to-day running of life and working in life becomes a lot more pleasant.
If only we could put breath into a pill.
It's called a breath.